Hi everyone, I'm Tom Slavic and welcome to TSPN's News for Today. And today in depth, we're going to be talking to Debbie Schug. Debbie's with HICAP. How you doing,
Hello.
Debbie? Good
Wonderful.
to see you back again. I think once a year you make it here, maybe more than once a year, but this is the big time of year. We're already in the time where people are looking at their Medicare, and it's changing. You have to fill out all the forms, and they can be quite daunting. In fact, I think maybe they're set up to be quite daunting, or it's just so complicated.
The options are very complicated,
Okay.
yes.
And your outfit,
HICAP.
helps people get over and navigate that Medicare maze, I think it's called, right?
Yes, that's what we call it.
Okay, and indeed it is. I looked at ours, for me and Sue's, and once again, your eyes start to cross a little bit and say, what is all this? And also, it's such a big thing because if you seemingly make a mistake or don't understand it right,
or just ignore it.
You could be stuck. So
Yes.
So that causes, I would say, causes some anxiety to some people as well.
Yes.
And so it's probably like the second, it's probably like filling out your taxes again. Another thing like that, right? Oh my gosh, I have to get this right.
And it's coming around again. Yes.
Okay, Debbie, how long has HICAP been helping people?
Since 1983, I believe.
Okay, so you have a lot of experience.
Well, the program has, yes.
Right.
I've been with them for 13 years.
13 years.
Yeah.
Okay, all right, that's great. And started October 15th, and it goes till December 7th. Now, how does your outfit HICAP help?
Well, October 15th through December 7th is the annual open enrollment period for Medicare Part D, and HICAP helps the Medicare beneficiaries by having them come into the office with an appointment with their medications and their Medicare card. We enter it into the database, and it pulls up the plan that's best for them by costs. If they have a specific pharmacy they want to go to, or they only want mail order, we can put all those specifics in, and it'll pull up the plan that will work best for them based on their personal formulary, their own drug list.
Okay, so it's a good idea, I guess, to call, set up an appointment, and come and see you. Okay.
See HICAP.
How many people help in HICAP?
We have 22.
Oh my gosh.
22 people. There's four staff members, and the rest are all volunteers. And some of the volunteers in Amador County alone are the most seasoned. We've had them there. They've been HICAP volunteers for 20 years or more, or 18 to 20 years. I mean, they're very seasoned and they know what they're doing. Amador's very lucky, very, very lucky.
Okay, so for people that act quick, why don't we give them the number to call just at this point? We'll continue on talking about Medicare D, but to call, if you want to, get the jump on it and start to make an appointment because you load up.
Oh, definitely. The phone number for the 800 number is 800-434-0222, or the local phone number, which is Sonora, is 209-532-6272. And just ask for HICAP.
Okay, so just from what you've heard, you can start. Now, there's different parts of Medicare. We're only going to be talking about Part D.
Yes, the
which
drug
D,
program.
if you think about, that's for the drug program, and that's the latest part of Medicare, isn't it?
Yes, that started in 2006, and the rest of it started in '65. So, yes, the latest and greatest is Medicare Part D. It's also probably the most confusing. This year, there's 25 different drug plans, and they each have their own formulary, and each one of these insurance plans go out and barter with the pharmaceutical companies. So one plan might cover one med cheaper than the other plan, and that's why the database helps pull up for the client the best way to go for cost efficiency.
Okay, how did it get to be 25, or is it?
Well, the first year there was 52.
Okay,
so it's come down.
Okay, so do the different, what do you call them that goes out and finds the different drugs?
The insurance companies, the insurance plans.
Okay.
So the insurance plans, there are 25 of them. Well, there's 25 plans. Some plans have multiple. Some insurance plans have multiple plans, but they go out and they barter for, say, Lipitor, and one will barter for Atravastin. By law, they have to have 2 meds for each of the top 100 ailments of seniors, but they can choose those 2 meds. So if let's say you take Lipitor, but then your doctor changed you to Atravastin, you might pay more for the generic on that particular plan. So that's why the client's specific formulary that they're taking is very important to us, and that's why we ask, tell us what you're taking now, or if you know you might be taking something new, we'll check it and make sure you're covered for next year.
Okay, well, in a way it sounds confusing to be set up like that, but in the other sense it sounds like there's a lot of competition between the 25 different people that are offering, so there's savings or involved, so that's why you have the choice of so many?
Well, one plan might not cover the medication you're looking for. But the other day I had a client that had a very specific medication. Only one plan was covering it out of 25. So he didn't really have a choice. If he wanted that particular med covered, he had to go with that plan. And it was a very expensive med, so of course he went with it. But there was only one covering it. Last year there was 9 or 10. So it changes, and every year the plans can add or delete drugs from their formulary. They change their premiums. The deductible changes. Last year was $320. This year is $360. And the plans don't have to charge $360. They can have a zero deductible, a $230, a $150. They can choose. So all those specifics are to the client. I mean, it's up to them what works best for them.
Okay, so it sounds like the program that you have, it's not like a computer program or something, where you put all the information in, and it comes up, and that's probably what people at home trying to figure this out on their own lack, right?
Well, it's a public domain website. It's Medicare.gov. That's what we use.
Okay.
But we know all the idiosyncrasies of it and how to make it work for the client. What would take a client a full day, we can do in less than an hour.
Right.
Because we're trained on it.
Okay. So how does Medicare Part D work? Who pays for what?
Okay, how it's supposed to work is that the client pays 25% after their deductible, if the plan has a deductible, and the plan pays 75%. For 2016, the total between those two parties reaches $3,310. Once that amount is reached between both parties, then you hit the donut hole. And you're in the donut hole where you get a 45% discount on your generic or your brand name and a 58% on your generic till the total reaches $58.50, and then the government says, okay, you've paid enough for your medications, we're going to pay 95% of your drug costs. And we do have clients that hit that catastrophic level by March.
Yeah, a lot of drugs are quite expensive.
Quite expensive, yes.
All right, and okay.
So during the donut hole, the insurance company and the federal government help cover. And when you hit the catastrophic, it is the pharmaceutical company that picks up the tab.
Okay, what is the cost in when you're in that donut hole?
Depending on your med, if you have a brand name, you're going to pay 45% of the brand name. So if it's $100, you're going to pay $65 rather than the $100. So it used to be when Medicare Part D first came about, you paid 100% in the donut hole. So it's slowly dwindling down, and in 2020 it'll stay at 25% until you hit catastrophic. That is the plan.
Okay, all right. Well, obviously, with all these changes and things, people need to look at their plan every year.
Yes, it is crucial for people who have a standalone drug plan to look at have their plan reassessed, even if they don't change. Then at least they know for themselves, they're empowered to know that they have the best plan for them. Some people don't like change. They just want to know how much it's going to cost them, and that's fine. That's what HICAP is there to do. We don't sell anything. It's unbiased information. We're there to help them. So,
do the programs change in the sense? I'm probably not using the right words, but so one program that you're on might have, or the program that you are on, that drug was cheaper that year, and can it cost more the next year?
Yes, exactly. So
you really wouldn't want to say, well, I went with that last year. That's
it's going to be the same.
And just it wouldn't necessarily be the same.
And what will happen is clients will call the plan and say, hey, I take this or this, and they say, well, brand names are going to be this much and generics are going to be this much. But they didn't ask what the name was, because they give them a range. Brand names will be between 25 and 65. Well, they paid 25 last year, so they're going to assume it's the same. But next year it could be 65, or could be the high end of it. So they need to check.
I have to say myself, and just talking with you and hearing all these numbers, the inside of my head is kind of glazing over already. Maybe that's because we don't have paperwork out in front of us and things, and numbers kind of need that physical part.
Yes, and we show them on the screen.
Right.
We're going step by step with them. And then Medicare.gov has a beautiful little color chart, so we can show them exactly what their next year is going to look like.
And the other part is, I think when you talk to an expert about it, they make it seem so easy, and you're going like, I'm confused already. And,
yes, I agree.
And so it's easier that because you can go to this person and say, let's, this is going a little bit fast for me.
Tell me what to do.
Yeah, help me out. Help me out on this.
And we don't tell them what to do. We give them their options. And if they say, okay, I don't want a deductible, okay, we can look down. Okay, this is the first plan without a deductible. Well, I have to use this pharmacy because I deliver. Okay, they don't use that one. So we go further down the list. We can make it specific to that person. But if a client were to call every one of these companies, they would be so confused. Even Medicare.gov, if you've never used it before, it's a great site, but it is confusing.
Okay, so that to me would come into too where you really want to be able to trust the person that you're sitting down with next, and and hoping or trusting that they can help you and they know what they're talking about. And your HICAP has been doing that for a lot of years.
Since Part D started, we've been doing it. We were
Okay.
trained the very first year before.
And I imagine you have a great reputation here.
I hope so.
Okay, I've never heard anything.
We've helped hundreds of people, thousands of people, and during Part D we usually help close to 2,000 people, and last year we saved them over $1 million.
We might go over this again, but where do people get the help, when they need help?
Well, we cover 5 counties. Area 12 HICAP covers 5 counties: Amador, Alpine, Calaveras, Tuolumne, Mariposa. In Amador County, we have counseling right here at the Amador Senior Center, and you call the 800 number or the 532 number. We'll make an appointment right there, and they still have appointments available.
Okay, and like I said, you want to be able to trust the people that are there, and know that the people have experience and know what they're talking about, especially when you get older, because you might not be thinking as clear.
Right.
And so
You need somebody
this
to
is a year
explain
you're
it.
an older.
Yes.
You're a year older than that time, and we don't stay at the same level of.
And change is scary sometimes.
Right. Okay. So we're going to be taking a break, and then we'll be back and talk more with W. Schug. So stay with us right here on TSPN.